chosen the panelists in such a way, each one are from different fields. I'll start with Geetanjali auntie. Geetanjali Sen, she's an author, she's an academician. Before we share our point of view, it's very important that she sets the stage that what are the challenges an elderly faces in their day-to-day life, and from there, we can take it forward. I request Geetanjali auntie to start it.
All I have to thank Infinity Group, especially Aninda and his team, that I am here today on this platform and speaking from my experiences. The whole thing is a huge topic. A lot of challenges are there, no doubt. And as you know that when COVID took place, we were all in the house for some time. So we did some reading, singing, whoever likes whatever, to motivate oneself. And that way I came to know that United Nations has said, like Aninda said about Calcutta, so many we are in the elder persons population. Now in the world, if you take, according to United Nations, it's going to touch 8.5 billion in 2030, which is just that scares. But then no need to get scared. I feel if the spirit is right, positive attitude towards life with positive happenings kept in mind that give us a little bit of happiness, all this makes a lot of difference, and we move ahead with the very we can say that the old age becomes gold age. So if all of us are same, then it was much easier. But that's not going to be the case. Every two individuals will be different. So many individuals will find lot of differences. Now the whole topic is changing paradigm in geriatric care services. I'm very happy with what I get as rejuvenation, relaxation in Jagriti Dham when I go just for a day trip also, if it is possible. Why? Because my mother is 90, so she is the oldest. I am 65 plus. I am old. I handled my husband who had Parkinson's disease when he started at the age of 67. So with all this experience, all the teaching and all that has gone. It was a different ball game. Now I am handling and learning how to keep others happy, and that gives me a lot of satisfaction. So if you consider taking from United Nations, if you go to WHO, they said we've set up pillars. The health has to be taken care of. Elder care people have to be well looked after. They must have lifelong learning, participation, which will give them security, sense of belonging. Now again there we have a lot of differences. So what I feel is that from my side, if I keep on complaining that I'm not getting enough, that won't help. That's a negative. So let's be positive. Again I say that there are medicines all of us have to take after the age, certain age. Everyone has to take medicines. Then so medication is there, meditation, something to do with the mental stimulation, physical, that is mobility. A lot of M's are coming in. Whatever is of utmost importance to the elder care, elder people. Whatever do, old, older, oldest. Now then the variety comes from wherever you are getting the care from. Now care can be at home, in-house, or if a person is mobile and likes to go out, then go to a place where you spend a day or so with gardening or looking at flowers. So many things you can still do. If mental stimulation is there, we can continue for quite a number of years. Now far away traveling, I will not suggest for all, but if it's possible, yes, it is. Because sometimes I've seen in my husband's case, airlines helped a lot. But we have to spend also a lot. Okay, fine, that's one part. Now we can go to nearby places. Talk to positive people. Don't hurt the negative. Anybody who is depressed, maybe, different natures can be there in front of us. Somebody happy, somebody sad. We won't hurt anyone. But at the end of the day, whoever gives me care, my mantra is, I have to say thank you to that person. So gratitude gives me a lot of happiness. That at the end of the day gives me some number of hours of good sleep. And then there are so many other things, nutrition and all, they take care. Now I have also noticed after my first exposure with Jagriti Dham that they have trained those people, I guess, this is my guesswork, that they have trained the compassionate and the patient people. They make good passionate elder care givers. So they need again some gratitude. And if this happy sort of chord is struck between the caregiving institutions and the people who are old, then the team will be working well and we'll be in the right direction. And Japan is another example we can take, because Japan, many people are over 100. Now they are very good at mental work. They're doing their own work. When I went to Vietnam, I also saw everybody is working. Some old ladies, they were just making those bowls, white colored bread, and they would do that work that would give them some sort of positivity. So this is something I admire. But yes, it can be suddenly I'm struck with something that hurts my mental ability. In that case, I will have to depend on them. But if from time to time the wiring connects, I will remember that I had thanked and they also smile. Smile makes a lot of difference to me. So there are specialists who are here, they will talk more on all this, and this is what I have to say. I don't expect a lot, but change is the only constant thing in this world. So changing paradigm in geriatric care services, I suppose.
Sukanya, specifically, what is the problem and how your organization is trying to solve it, if you can share with the audience.
So thank you BCC&I, wonderful opportunity. I love speaking on topics like this, very, very close to my heart. Thank you Jagriti Dham, Aninda. I mean, again, I can go endlessly, but I know there's a time limit to it. I will, with the topic that we have in hand, the paradigm shift in geriatric care, let me start on a lighter note. Remember the song by Nochiketa on Vriddhashram and how blackened it was portrayed and how it was such a bad thing to fall back upon a support system for the elderly? Days are gone. I cannot agree more to what Mr. Chowdhury said on the ads which are coming now, which are kind of highlighting that there is no shame in falling back or exploring additional help. When Mr. Arvind said that, as primary caregivers to our family members, we are also juggling career, we are also juggling our personal lives. So there is absolutely a requirement in today's day and time to find resources, to find avenues where elderly people can find that solace, can find peers, can find comfort in living a life that is filled with dignity, because that is possibly the first thing that is taken away from the sunset years, dignity. You don't know how to do it, let me do it. Possibly even a grandchild coming and grabbing the remote and saying, "Oof, tumi kaat chona, let me show you." So the first thing that goes away when we're talking about sunset years is possibly dignity. And when it comes to avenues or places like Jagriti Dham, retirement villages, care home, hospice care, or home care, it's a fantastic landscape that we're talking about. Now, if I draw parallels from Europe, where we predominantly started working and we are now exploring India as the company that I represent in InvictIQ. Now, if I draw parallels from, let's say, UK or a Denmark or a Sweden, I know that I might not be able to cut, copy, paste what they are following there, because fundamentally, traditionally, Indian community, Indian mindset is very different. We will still choose family members as our primary caregiver before we move on to something else. And precisely that is why we'll see that while care homes or retirement villages are quite a requirement abroad, here it is always a secondary choice, the primary choice being home care. Now, like again Mr. Chaudhary said, there's a plethora today. If you just Google, you'll not get an exact number of home care agencies that have cropped up in India. There's no number. But if you look around the paper, Google, there's pretty much every company who's assuring you of good care. Is there an assurance? No. Who's measuring this? Who's regulating it? Nobody. I'll not name, but bigger brands on discussion have said that, it's just our voice. Tomorrow we let out a paper ad saying we make it safer by 80%. People will take what we're saying because there's no data to prove. Now, data again is something that is very close to my heart. Now, what COVID did and what Mr. Ambani did with Jio, practically technology, wanted or unwanted, is in everybody's pocket right now. We are possibly the world's largest data consumer, the largest data producer. What can that data do for geriatric? Now, before even I say that, obviously this is health tech, I cannot leave behind AI, I cannot leave behind technology. That is what also our company represents. And before making it sound scary like AI for a sector of people who might not be very tech savvy, for whom technology might not always be the easiest thing to adapt, there are still so many stages where AI and technology can be invented, right? So even before I go into IoT of things and rings and magic pillows and smart mattresses, what am I doing to enable my caregivers? Am I thinking of a product? Am I thinking of technology which will help their processes, which will help optimize their care delivery? Because I remember Mr. Rana in the morning said, that your employees deserve a pat on the back, not just on Diwali and Holi. Technology is that pat on the back, make it easy for them to deliver care. Because, and I totally empathize with doctors, nurses. If you are day in, day out dealing with people who are unwell, on the harbinger of death, it's very easy for themselves to get impacted, right? How much can you watertight yourself to these emotions? So in that case, how am I using technology as an enabler, to make my life easy, to make the processes optimized? I totally agree with what Mr. Arvind said. Nothing beats a hug. Nothing beats, your child coming and saying and hugging you, or for that matter, even a carer's touch, helping them take a walk around the garden. So in that case, we can talk about technology endlessly, and even while I represent a company which is thoroughly all about data and technology, we know, at least in the care sector, technology will always be just an enabler. It can never ever replace what human can do as carer. Now, before possibly I would stream into everything that everybody said, and I would say that at the end of the day, it is very, very crucial, because right now we are in a beautiful cusp, the whole elderly care sector in India. Now, first and foremost, possibly would be a small request is not to club anything and everything to do with senior citizens into one bucket of geriatric care. The elderly care market, the elderly care segment is much bigger than just geriatric care. So what exactly we are doing, and like rightfully said, how can we think of processes, how can we think of products which helps us optimize, which helps us quality control, regulate. Because I can totally agree when anybody says, like Geetanjali Sen says, that I'm here, I'm taking care of my mom or my husband, but there are also simply so many children who are abroad, whose parents are possibly taking help from one of these establishments. How do they get peace of mind? So that is where technology can be used.
See, there's a huge, like what Jagriti Dham is doing right now, right? There are elite retirement villages and care homes which are coming up, okay? And in most cases, the parents who are taking these services, the children could be staying abroad. Now abroad, they are very well familiar with a very regulated care sector, where there are regular audits every year, where even training is mandatory and so on and so forth. So I do not know if just putting two and two together, if there are like-minded such organizations, they can always go ahead, avail such services, but like as Nilanjana ma'am said, they have to make sense for the people taking it, they have to make sense for obviously for the eventually end customers. But at the end of the day, if if a care provider based in India can be in sync and say that, we are matching global standards. Look, all our staff is trained. Look, this is how we do audit every year. It's a match made in heaven. It's a matter of time, like Arvind said. More kudos to you, more power to you. Be the first one to start, but it's just a matter of time.
I'm so happy that startups like her, at least coming back to Kolkata and trying to solve this major problem.
Of course, you need policy and you need certification. But what I find over the years, I have also been involved with the National Institute of Social Defense, where we have a caregiver program. It's the modules, the design of the modules that's a problem. So if you want a caregiver to be trained in dementia care, it cannot be just teaching them about dementia, the signs and symptoms, and the medical perspective. It has to be from the human perspective, and I think practical training, hands-on training, exposing them to what dementia is all about, not theoretically but practically, and I think that's what is missed in most of the modules. And our organization, we train 4 times a year, and what we have learned over the years is if you can change the modules, make it interesting for people to come and take it, you definitely won't be disappointed, because over the years we have younger people, more and more younger people coming and wanting to be trained, because they do see a huge area where they can contribute. So I think designing modules is very important. How you are designing the modules. Thank you.
যখন যৌবন বা কম বয়সে আমরা যে কোনো পেপারের যদি দেখতাম রবিবাসরীয় যে অ্যাডভার্টাইজমেন্টগুলো, তাতে ওল্ড এজ হোমের অ্যাডভার্টাইজমেন্ট থাকতো একটা ছোট্ট কর্নারে, আর আজকাল ওই ওল্ড এজ হোমের অ্যাডভার্টাইজমেন্ট হয় 2টো ফুল পেজই। অ্যান্ড ওই সময় একটা ইনিভিশন ছিল, দ্য অ্যাডভার্টাইজমেন্ট অফ দ্য ওল্ড এজ হোম। এখন সেই ইনিভিশন নেই, প্রাউডলি দে আর গিভিং দ্য অ্যাডভার্টাইজমেন্ট অফ ওল্ড এজ হোম। এটার মধ্যে কোনো কিছু রং নেই। এবং এই যে প্যারাডাইম শিফট, আমরা যদি একটু প্যারাডাইম শিফট নিয়ে কথা বলি, তাহলে another one paradigm shift is what? First of all, geriatrics is derived from the word geron. It is a Greek word. Actually, it is very much related with the word jora of the Ayurveda. ভারতবর্ষে প্রথম এই জেরিয়াট্রিক্সের উদ্ভাবন দেখিয়ে দিয়ে গেছিল, কিন্তু somehow it is not flourished in our country. It was flourished in USA and UK, but aste aste in last 1 decade, geriatrics become the aware field, not popular field. Even আমি যখন নিজেকে জেরিয়াট্রিশিয়ান বলি, তখন অনেকেই একটা ভুরু কুচকে ইয়ে করে, এটা আবার কি জিনিস, এটা খায় না মাথায় দেয়। সো হোয়াট ইজ জেরিয়াট্রিশিয়ান? লাইক নীলাঞ্জনা ম্যাডাম যেটা বলছিলেন যে একটা সময় ডিমেনশিয়া, এটা একটা পাগলের রোগ, এটা জাস্ট পাগল। সো এই যে শিফটটা হয়েছে, এখানে হোয়াট সর্ট অফ শিফট? Another shift is there is emphasis on geriatric people, because our population of the geriatric people is now nearly 13 crores. A 13 crores population in India, just one country in the Europe is more than the 13 crores population, Russia. Only the 5 countries of Asia, it is more than the 13 crores population. So 13 crores population of elderly people in India, এটা একটা কিন্তু huge potential customer for every field, not only the healthcare, but everyone is targeting this population. And if the 10% of the population is affordable, এটা কিন্তু একটা huge market. So now all the sectors are targeting the geriatric population for their business. Number 3, if another thing we are home-based care is now uprising. Home-based care, and I am representing 2 organizations. One is the Geriatric Society of India, that the organization, national organization, engaged with the geriatric physician all over the India. I am fellow of that, and I am representing another organization, that is the Majbo. Majbo is the NGO, that initiated home-based elderly healthcare support in 2007 when that sort of conception was not there. আমরা 2007-এ শুরু করেছি যখন এই হোম বেস কেয়ার বলতে কোনো ধারণা সে অর্থে ছিল না। ইন দ্য ইস্টার্ন ইন্ডিয়া উই আর দ্য ফার্স্ট অর্গানাইজেশন এবং আমরা তার জন্য রেকগনিশন দিই, সেগুলো আমরা এখানে বলার জিনিস নয়। বাট নাও দ্য হোম বেস কেয়ার ইজ পপুলার এবং বিভিন্ন কোম্পানি ইন দ্য লাস্ট 5 to 6 ইয়ার্স দেখবেন অনেক কোম্পানি এসছে হোম বেস কেয়ার। বাট হোম বেস কেয়ার, whenever home based care, it is not only the care of the odd job or লাইক পেশেন্ট একটা বয়স্ক মানুষকে ব্যাংকে নিয়ে যাওয়া কি হসপিটালে নিয়ে যাওয়া। মেনি অফ দ্য অর্গানাইজেশন তারা কিন্তু কি বলবো সচেতনভাবে হেলথ সেক্টরটাকে খুব একটা অ্যাড্রেস করে না। বাট দিস ইজ দ্য ভেরি মাচ রিকোয়ার্ড সেক্টর ইন, যেটা মডারেটর বলছিলেন যে জেরিয়াট্রিক পিপল দে আর নট উইলিং টু গো হসপিটাল। অ্যান্ড এই ট্রেন্ডটা কি হয়েছে এখন যে হসপিটালে দেখবেন 70 to 80% বেডস আর অকুপাইড বাই দ্য জেরিয়াট্রিক পপুলেশন যে কোনো জায়গায়। এবং এই যে জেরিয়াট্রিক পিপল আর নট উইলিং টু গো হসপিটাল, সেখানে হোম বেস কেয়ারের একটা প্রাধান্য এসেছে। বাট নীলাঞ্জনা ম্যাডাম যেটা বলছিলেন যে কেয়ার গিভার্স, অরবিন্দের মতো কেয়ার গিভার, নিজের বাড়ির কেয়ার গিভার শুধু আলাদা, কিন্তু আমাদের এই কলকাতার পপুলেশনে 27% অফ দ্য জেরিয়াট্রিক পিপল, আমার একটা স্টাডি আমি করেছি এবং সেটা আজতক এবং অন্যান্য জায়গাতেও হয়েছে, প্রচার হয়েছে। তো সেখানে মোর দ্যান 27% অফ দ্য এল্ডারলি পিপলস আর জাস্ট দুজন থাকে, কোনো কেউ নেই। সেইখানে ইম্পর্টেন্স অফ দ্য কমিউনিটি লিভিং সেটা ডে বাই ডে ইনক্রিজ করছে এবং যেটা জাগৃতি ধাম করছেন, ভেরি গুড এফর্ট। অ্যাফোর্ডেবল পিপলের জন্য অবশ্যই এটা আমি সবসময় রেকমেন্ড করবো দোজ অ্যাফোর্ডেবল পিপল, তারা কিন্তু এই ধরনের কমিউনিটি লিভিংয়ে যাওয়াটা কিন্তু শ্রেষ্ঠতর, বিকজ তাদের আর কোনো চিন্তা কিচ্ছু করতে হয় না, সবই কিন্তু আন্ডার ওয়ান রুফ। বাট আনফর্চুনেটলি অ্যাফোর্ডেবল পিপল কতটা, সেটা হচ্ছে যে একটা জেরিয়াট্রিক পপুলেশন আমাদের ইন্ডিয়াতে সেখানে 10%-এরও লেস হচ্ছে অ্যাফোর্ডেবল পিপল। So anywhere the discussion is going on, we are not targeting the BPL sector of the elderly people. But elderly people to শুধু elder care does not mean it is only for the affluent society. আমার ব্যক্তিগত অভিজ্ঞতায় আমি একদম গ্রামে কাজ করেছি, সুন্দরবনে আমাদের জেরিয়াট্রিক ক্লিনিক চলে, ঝাড়গ্রাম জঙ্গলমহলে চলে, সেখানে যেমন আমার এক্সপোজার উইথ দ্য জেরিয়াট্রিক পিপল, রুরাল জেরিয়াট্রিক পিপল, আবার এক্সপোজার টু দ্য অ্যাফ্লুয়েন্ট সোসাইটি অফ দ্য কলকাতা, কোটি কোটি সঙ্গেও আমি কাজ করি। ফলে সেই দুটো জায়গার এক্সপোজারের ভিত্তিতে বলা যায় দ্য প্যারাডাইম শিফট হোয়াট এভার ইজ হ্যাপেন, ইট ইজ অনলি ফর দ্য অ্যাফ্লুয়েন্ট সোসাইটি অফ দ্য জেরিয়াট্রিক পিপল, নট ফর দ্য বিপিএল অর দ্য আন্ডার প্রিভিলেজ গ্রুপ। সেখানে বরঞ্চ ডিটেরিওরেশন হয়েছে জেরিয়াট্রিক কেয়ারে। নো ওয়ান ইজ known about the geriatric care, no geriatric oriented physicians, doctors are there, no clinics are there. আমাদের ওখানে সুন্দরবনে তার বয়স্ক লোকরা দেখাতে আসে নদী পেরিয়ে 2 ঘন্টা 3 ঘন্টা 4 ঘন্টা নদী পেরিয়ে, জাস্ট টু গেট দ্য ফ্রি মেডিসিনস। সো সেই জায়গায় প্যারাডাইম শিফট একটা বড় সেক্টর হয়েছে, ইট ইজ বাই টার্গেটিং দ্য অ্যাফ্লুয়েন্ট সোসাইটি। আপনার আরেকটা জিনিস, দ্য মিডিয়াস আর নাও plays their important role to promote the geriatric care, not only print media, electronic media, সব মিডিয়াতে এখন আস্তে আস্তে এটা আমরা we are very much happy and pleased যে এটা আস্তে আস্তে এই জেরিয়াট্রিক সেক্টর নিয়ে আলোচনা হচ্ছে, যেটা টুডে this is the example, true example of the paradigm shift of the geriatric care, that sort of topic is there in the BCC&I's health summit.
Who has been promoting retro music in Kolkata, is a living encyclopedia of Kishore Kumar and RD government. But apart from his day-to-day profession, he has been associated with number of senior living homes, and he has been using radio as a platform in a much better way. Arvind, to you, what role radio can play, and second is what role music can play in the form of care.
She did not even take out the paper a single time. When she was talking, what she was talking, and taking it from Nilanjana, she mentioned the words caregiver. I'll not stretch it much, Aninda, but with your permission, I think we're all made up of stories. How many of you have elderly people in the house? Raise your hands. In-laws. parents, have you heard this one line quite a lot? তুই আমাকে বলিস না আমাকে কি করতে হবে, yes or no, right? You know, that's the first thing that I realized as a caregiver. I have parents back home. When my mother was diagnosed with cervical cancer, I had an experience that has given me a lot of life lessons on how to take care of elderly people. I think one of the first things that we should realize is the form of communication jeta amra elderly people der sathe kori, that keeps changing from time to time. When you're 10 years, you have a different form of communication. When you're 20, apna ekta alada communication thake. When you become 40, you have a different form of communication. Sometimes elderly people take that line when you're taking care of them, when you don't want them to go somewhere, they feel you're intruding into their personal space. They feel you're trying to control them. So one of the first things that I realized as a caregiver myself is that line has to be bridged. Jekan tumi communicate korte paro je ma baba, I'm not trying to hurt you, I'm just trying to do it for your own good. And them also, they realize that you're doing it for their own good. When my mother was diagnosed with cervical cancer, one of the first things that I did was I sat down with her and I said, এই ক্যান্সারটাকে ডিফিট করার জন্য কি কি দরকার আছে তোমার? Discipline, diet, nutrition, finance, write down all the points that you would need to defeat this cancer. And then I told her that the cancer is more of a friend to you. It's not your enemy. It's getting you to teach and learn all these lovely qualities which you wouldn't have learned if you wouldn't have been diagnosed with cancer in the first place. I'll tell you a small story. Amar ma jokon hospital e chilo, I remember I looked at it from her eyes and her perspective. You know, elderly people think of the world in a very slow way, and there are administrators here, there are doctors here. I would request each one of you to get the operations in the hospital a little slower, you know, for them to understand what's happening around them, because they look at the world like that. They don't look at the world je ekhoni korun eta ni eta chole jan. The caregiver who's coming inside, tar jonno hoyto 10 ta patient ache, but for the patient, that caregiver is the only person who's coming. So that process needs to slow down. I think we underestimate the importance of spirituality. This is my third lesson. I think it's one of the most key areas that's been unexplored by anyone. You know, when I told my mother this, and I'm saying this on the dais, and this is probably the first time, I said, ki hobe, maximum mara jabe, you'll die. At the end of the day, aaj na hole kal, everyone has to go. So why don't we go with a little smile and try to see what are the things that we could actually correct in our everyday lives. Let's go with gratitude. Let's go with happiness. Let us find that, and that's why definition and acceptance has to come. Why me? Amar keno holo? Amar cancer ho uchit na? I should not have had Parkinson's. Why am I suffering? My son is abroad. My daughter is abroad. Elderly people do this quite a lot, and I think I'll also be doing this when I grow old, to be very honest. And bolata khub easy je theek hoye jao, but when your blood sugar and your sodium potassium levels are nice, you're talking to an elderly person je mane bechara bed theke uthte parche na, it's very, very easy to give them an advice, but I think it's very difficult for them to absorb this also. So I think the bridge is understanding spirituality, understanding in terms of letting go of life, and understanding that everything happens for a reason. You will grow old, you will, need to have medicines. The most powerful man in the world, is no exception to this particular rule. Lastly, the importance of radio. I'm going to come back to this with a wonderful story to share. I think we can do little things in our everyday life that can, get the quality of life for elderly people to be a lot better. First is, I think we need to be a society that is not obsessed with growing young. Apni television ta dekhun, ei cream ta dile you grow 10 years younger. Apni newspaper ta bar korun, you use this particular cream, you go 20 years younger. So let's not be obsessed with the young. Let's be a little bit more obsessed with the elderly, knowing that aaj na hole kal we're going to be there in their shoes also. So treat that with a little smile. And one lesson for caregivers: don't get burnt out. It's something that I realized. Mane sarakhon na ami baba mar care rakhbo, ami movie dekhbo na, I will not meet my friends, I will not talk to people, I will not listen to music. Please listen to my radio station. I play enough Kishore Kumar and Kumar Sanu songs. Try and take out some time for yourself, because apni jodi nijeke na bhalo rakhte parben, আপনি অন্যদেরকে কোনোদিন ভালো রাখতে পারবেন না. This is one of the very key areas, for elderly care that I think most people don't realize. take some time for yourself, fall in love, go and meet friends, and involve your parents in every step of the process so that they don't worry about what needs to be done. Lastly, on it though, I think most institutions need to know this, especially panelists like Nilanjana. Community radio plays a huge role. আপনি যদি rural areas এ কাজ করতে চান, community radios are a boon and a blessing by the government of India right now. It takes 6 months to procure a license. If you've been an NGO or an organization that's been in operation for more than 2 to 3 years, you can read it on the website. Apply for community radio. There's an operational expense, but you can train health givers, caregivers, elderly people. Someone like Geetanjali could be a radio presenter, tomorrow. She could do a show on what it takes to live life, from her prism, her perspective. So you could easily do this. I'll be more than happy to help out and train radio presenters. And I think radio or any other medium plays a huge, important role in the larger scheme of things. But at the end of the day, at a line, jeta mane bola hoyechilo ei stage, and I'm going to hand it over to that, is change is inevitable. What we are talking about right now is something that we're going to be dealing with tomorrow. I heard a lot of AI from start to bottom today. AI will do this and AI will do that. But I can assure you 1001%, and please put this on camera long after, even if I'm gone, there is no robot that will compensate the lovely touch of your child coming and hugging you and saying, "Ma, ami tomake bhalobashi, baba, ami tomake bhalobashi. Thank you so much for everything that you have taught me." This is how life has to be. So AI will help us, do that surgeries and everything. I think it's beyond AI that we find a heart that beats, a smile that is genuine, and lastly, courage and acceptance. That is our way forward with geriatric care. Thank you.
I forgot your name. Yeah. Let's see, I have just one thing to say. I say this from an entertainment perspective, because I come from a line where there's constant battle between revenue and what I need to do. There is something that the sales team tells you to do and something that I really want to do, idealistically, on radio. So, money is where the crowd is, and crowd is where the perception is. Till about a couple of years back, before a movie like Lagan released, you wouldn't even look at the story of a movie. You would just go because it's a star and you would like to enjoy, right? Why is it today that producers and directors are writing different scripts? Because they see a different audience which is ready for the kind of movies that they want to make. So I take this and compare this to what you want to do. 15 years back, if you would have asked me this question, I would have said, God is going to help you, and let's see when the policies are going to change. You have something called the internet in your hands. You have something which is the mobile phone. While using it to the best possible effect, it's like a fire in a jungle. I can tell you this, if you light a spark, it could just explode. Once you have the numbers on your side, the guys who are taking their decisions at the policy level will notice you. The people who are going to invest money will notice you, because it all comes from the crowd. And it's very easy for you to connect to like-minded individuals, create groups, create communities and forums. I know it's not an overnight job, but someone has to do it. And I pray to God that you'll be the first one to do it. And you and other people similarly need to come together. Get people like Aninda, get people like Dr. Chowdhury. Bring together discussions like this. Use the internet to explode, amplify your cause, and I trust you that the health policy makers are going to take note of it and say, if there is a crowd which is interested in this, I'm going to put my money and energy into making a policy change right now.
Before we end, a small request. Let's take a vow, a small vow, that no elders in Kolkata should feel lonely. Ladies and gentlemen, that's a small vow we can take and end this. Thank you, Bengal Chamber.